Welcome back to the lecture series on repertories. I am Dr. Kedarnath A. Longani. I am a M.D.Homoeopath. Today we are going to see the topic Repertorial Totality and Potential Differential Field P.D.F. Repertorial totality is also called a repertorial syndrome, as it is a logically related group of signs and symptoms. A homeopath forms a portrait of the disease by collecting the data from the patient's attendants or relatives, and from his own observation. By logical arrangement of the symptoms, a conceptual image is formed, which gives the totality of a case. This totality serves the purpose of selecting a right medicine by finding out the most similar picture in the materia medica. This totality is the basis for repertorization of a case. For the purpose of repertorization, the totality erected is essentially based on three fundamental principles, that is Bonninghausen, Bogar and Kent, depending upon the case. Symptoms are arranged according to their hierarchy, which forms a totality. But for the purpose of repertorization, such hierarchy may have to be restructured as per the principles and methodology of the repertory to be used. This restructuring is done either because they, rubrics, are not represented well in that particular repertory, or they do not fit well with the logic of the repertory. So, the original totality must be modified or restructured accordingly. The modified totality as per the repertory used is called repertorial totality. The symptoms which still remains after deducting the repertorial totality from the conceptual image are called potential differential field, means PDF. The PDF helps in the differentiation and finalization of the remedy among the group of medicines obtained by the repertorization. Hence, PDF consists of finer general symptoms or striking characteristic symptoms. For example, we will see a few examples. Thermal conditions like hot or chilly. Then comes the desire and aversions. Then comes and some characteristic expressions which are not represented well in the repertory. Symptoms which are present in PDF can be referred either to the repertory again or to some books of materia medica. Thus, conceptual image minus repertorial totality is equal to PDF. For example, we'll see 20 symptoms makes the conceptual image, out of which portrait important symptoms, which are 7. Now the remaining symptoms are total 13. These 13 are PDF. So 20 conceptual image minus 7 repertorial totality, 13 are PDF. As the repertorial syndrome is ever changing, variable and dynamic, and so also is the PDF. Few important things we will see. Natural disease is greater than the patient. Drug disease is greater than the prover. No two individuals are alike in health as well as in disease. Hence, all these things are ever changing and variable. PDF changes from patient to patient, even if repertorial syndrome which is fixed. Now we will see, or we will try to understand the repertorial totality, PDF and conceptual image through a map. Thank you for listening the lecture on repertorial totality and potential differential field. If you like the video, then please do subscribe and share. Thank you once again and see you soon with the new video.